So I went to my doctor, what was it? I think on the 8th, 9th or something. Anyway, and for the results from the CT scan that I had done, and everything grew back the way it was supposed to, so that's good. But now we're at a loss as why I'm still having this back pain. I don't know, but when I went and saw my chiropractor, he said that there is some degenerative joint disease or something like that, DJD. So whatever that stands for. So he thinks that that might have caused some of the muscles to atrophy, and so we'd have to see kind of how building those muscles up with the Centroforce bar will help. So I'm going to be getting one of those from him so I can do it at home daily and see if that will help kind of strengthen those tinier muscles in the back to make it so that I can actually bend over without having pain and standing up without having pain. I heard on the radio too, I think it's called like Symmetry, and they actually specialize in the SI joint, which is where I feel that the pain is coming from. So I'm going to try this out for a month. If it doesn't work, then I think I'm going to try to get an appointment into that place and see. And from what I've heard is they do like a bunch of intake forms and stuff like that, see how you're feeling. They do a points test where they touch on it, and then they will do an injection into the SI joint. If you get any kind of relief, even if it's just for an hour, then they know that it's the SI joint, and they will work with you from there. So that is something to look at if you're still having issues with the back pain after surgery. But I am actually excited to try the Centroforce bar. I really like it. I really feel that it works those lower muscles, but since I can only go in once a week or once every 2 weeks, I'm not getting the actual full benefit from it. And going to the gym and stuff, it's just it's a little harder on my back, even doing the elliptical. So my chiropractor wants me to just sit on the bike and do that, but actually do the Centroforce bar for only 7 minutes a day. And I tell you, it is an amazing workout. I might even post about this bar and show you guys what it does and how my journey is on it. So after I've been using it for a month, I'll post on that, see how my back is doing. It just seems like running is going to be out of the question for me at this point. So I'm going to have to, I don't want to say I'm going to have to find another love for something else, because running is amazing and it's not something that you can easily replace. So, but I am still on this journey to get my back to feeling better, and now that it is actually just located on that left side, and I think that we have a set goal in mind. So we'll try this out. I'll post in a month, see how it's doing, and kind of go from there. I'm going to be doing a lot of traveling this week. My oldest son is going to WSU, so we're moving him in there, and I'm really excited and scared for him. But those stresses come along too. Having Addison's disease and fibromyalgia is a lot harder on my body, and like I said, my body will heal a lot slower than somebody who is healthier. I'm having different scans and stuff done too. I just had my bone density test done today, so I'll actually be able to see where I'm at on there. I'm going in for some gastro stuff on the 21st. Had a brain MRI to check for MS. There's just a lot going on, and it's frustrating, but I think if I can get the back issue tackled right now, as far as pain goes, that's the one thing that bothers me the most. I can deal with fatigue because I can lay on the couch, but when your back hurts and you can't sleep, I think if I can get this under control, then I can kind of manage my other symptoms a little bit better. But yeah, so give me a month and I will post again about that. So I will do, though, a workout to show you what the Centroforce bar is and the different things that you can do with it. All right, thanks.